battling a fever and you don't know what to do, or you have a child at home who is battling a fever. In fact, millions of people face fever every day of their life. And and this depends on whether it's an infection or even you're having a cancer or something else is causing the fever, heat stroke, or anything that can cause a fever. Now, fever is not necessarily a bad thing. It is the body's response to inflammation or infection. So, in fighting a fever, the goal is to bring comfort. It's not necessarily reducing the temperature completely, but knowing what strategies to use in reducing a fever is very important, and also knowing when to see a doctor. It's very, very important. So, on this video, we want to talk about both the pharmacological and the non-pharmacological or the natural means of tackling a fever. And also we'll talk about fever in children and in adults, and when do you really have to see a doctor. So let's talk about the pharmacological means because that is what people are used to, and which of the pharmacological methods actually work very well for fever in adult versus children. Now, in adult, Tylenol or acetaminophen, it is the best form of medication to take, pharmacological medication to battle a fever. Now, if you have a liver disease, you do not want to take Tylenol at the higher dose. And so, if you have a fever and have a liver disease, you probably Tylenol is not your best option. And if your kidneys are fine, then probably ibuprofen will be the best option if you're an adult and you have a liver disease and you have a fever. Now, if you are children, what we have found to be more effective is ibuprofen or Motrin, children's Motrin. And this you can look on the bottle, and based on the weight, you know how much to give the child. And Motrin has been proven to be more effective than acetaminophen or Tylenol for reducing fever in children using pharmacological methods. Now, what about some of the non-pharmacological methods that we can use? Well, let's outline some of the non-pharmacological methods that we can use if you're having a fever at home. Now, this can be applied to both adults and children. Now, hydration is number one. Drink a lot of water, coconut water, clear broth, herbal teas, electrolyte drinks like Pedialytes. Now, the reason is that fever will cause fluid loss. And so you want to make sure that you're replacing that fluid loss to avoid dehydration. The second one is lukewarm sponge bath. Now, remember, it's a lukewarm sponge bath, not a cold water sponge bath. This will gradually reduce the body's temperature. And the reason you have to avoid cold, or alcohol wraps is that they can cause shivering, and this will raise the internal body temperature. And the third thing that you can do for both adults and children is resting, because most of the time fever is a sign of infection or inflammation. So resting is very important. Now, the next advice, the non-pharmacological way, is this is to adults only, to adults. The first thing you can do is to drink a ginger tea. You boil fresh ginger slice in water, add some honey to it, and the reason is that it has an anti-inflammatory property to help you sweat out the toxins. The second one that you can use in adults is turmeric milk. So you have half teaspoon of turmeric in warm milk. And again, because of its natural antimicrobial and anti-inflammatory property, if you're having a fever, this will be very helpful. Then the next one is apple cider vinegar compress. Now, you mix 1 part of apple cider vinegar with 2 parts of cool water and soak a cloth and place it on your forehead, your belly, or your feet. This is going to help pull the heat from your body. Now for children, this is very, very unique to children. If you have a fever, they are breastfeeding, you keep them hydrated. That's important. And you also can use cool compress, not cold. Again, it's cool compress. Apply it to their forehead, their armpits, their back, and the back of the neck. And make sure that they are not bundled up, that they are wearing a light clothing if they're experiencing a fever. Now, if you've done all these and the fever is not going, then when do you see a physician? Very important to know that. Now, For adults, if you have any fever of 103 degrees Fahrenheit or 39.4 degrees centigrade, you should see a physician, because that is not just a physiological response, because you may be having a serious infection in your body. Or if you have a fever that lasts more than 3 days, or it is accompanied by confusion, stiff neck, shortness of breath, or you are just coughing out a lot, sputum out, you're having a chest discomfort. If you're having a fever with the symptoms, you need to see a physician or healthcare provider as soon as possible when you're an adult. Children, you need to pay attention. If you're a mom or you're a parent, you're watching this video, pay attention very, very closely, because if you have a child under 3 months of age and they have a fever of 100.4 degrees Fahrenheit, that is 38 degrees centigrade, that's very, very serious. You should go into the ER or to see a healthcare provider immediately. Or children between 3 to 6 months old with a fever over 102 degrees Fahrenheit, or that is 38.9 degrees centigrade, you need to go in immediately. Don't wait at home at all. Or if you have a fever lasting more than 48 hours in the infant or the child, you should go in and be checked, because it could be a sign of a serious infection. Or if they have a fever associated with lethargy, irritability, they are not eating, they're refusing to eat and drink, something is just not right about a child, then you should see a physician immediately. Now, as a school of thought, if you have a sinus infection, sinus problem, sinus congestion, you're an adult and you have a fever of about 39 degrees for 3 days in a row, you should be seen immediately, because we're having a sinus infection that, if left untreated, can go into your brain or cause other complications. So now, if you're watching this video and you have your own fever reducing techniques that you've used before, either as an adult or as a child, and it's worked for you very well, I want to leave it in a comment here, because our watchers and our viewers would like to learn as well and take some pearls for themselves. Until then, I want you to subscribe to my channel, share this video with your friends because it may help somebody, and also give me a like and come back here weekly for your weekly tips for your health, because you are your own physician in the 21st century. Until then, Dr. Moses.